If your jaw clicks, locks, or it's just in pain and no treatment seems to last, hypermobility may be the case. So we're gonna, in this video, we're gonna explain what is going on with the TMJ, temporomandibular joint, and why it subluxes and it's such a big deal with hypermobility, and some of the things that I do in my practice treating joint hypermobility and working on the temporomandibular joint. So your jaw joint, your TMJ, is a ball and socket joint. So the ball portion is coming from your lower jaw and the socket portion is coming from the face, which is part of your skull. The issue, so imagine this is the ball and socket joint. There is a disc in between that provides cushion, and then there is a disc that provides nerve and blood supply. The issue happens when the one that has provides supply of blood and nerves dislodges and then it gets squished. So that's when the pain happens, that's when the subluxation happens, and there are different things you can do to avoid the opportunities when that happens. So I'm going to discuss that also. But the one thing that is very, very important is for you to realize there are things you may be doing right now that are really not helping your TMJ. Instability of all the joints is part of hypermobility. Managing hypermobility is what diminishes the chances of things going wrong because it decreases the inflammation. When you manage your hypermobility correctly, it decreases your inflammation, and the decrease in inflammation really impacts how lax your ligaments get. So when it comes to the management of the movement of the TMJ, we want to make sure that you don't open your mouth so wide. When you open so wide, it's much easier for it to sublux. So it's not how hard the food is, it's how big your bite is. So be careful. So you can have a piece of steak, just smaller pieces of steak, but chewing or like having a salad requires more grinding, which is an issue. So for you to think that, for example, wearing a night guard, that's not going to protect your jaw. That's just protecting your teeth from grinding. Does nothing to your jaw. When it comes to jaw treatment, we don't want to just focus on the jaw. We want to focus on the positioning of the head over the neck. So your neck is definitely a big player. Also, your breathing is a big player. A lot of times when we're breathing, when we do it incorrectly, we use the neck. We call it neck breathers. We use the neck to initiate the breathing process because we're kind of slouched forward and the diaphragms don't talk to each other like they should. And so it's that action that ends up pulling the chest off this diaphragm to initiate the rest of the breathing. So when you use your neck for breathing, you're really imposing on the position of the head over the neck and therefore impacting the jawbone itself. So position of the head over the neck, how your neck is being utilized. So that's also very important. When it comes to the things that we want to avoid, we also want to avoid yawning like the normal way. So drop your chin down and yawn so you're not opening your mouth so much, or sneezing or coughing, the same thing. When you go see a dentist, for example, you want to wear a child's block so you're not opening your mouth as much, and you do ask for multiple breaks. There is nothing wrong with you saying you're not being a princess. You're just making sure things don't go bad. By you being shy, you're not helping yourself, and the issue that you're having can last a long time. Massaging your face muscles is very important. So I always use the double knuckle, so like so, and I just go into my face and just kind of massage these areas. Don't be afraid to touch your TMJ, but be careful when you're going over the bones, it can be tender. So you can use the padded part, you can use your knuckles, give it a try and see, and then go also along the angle of the jaw over in these areas as well. Massaging your face and kind of working that soft tissue is very, very helpful. Most importantly, when it comes to TMJ, I want you to understand that attending to all of your whole body, all of your joints is very, very important, because when you start using your body properly, you're not inflaming the body, your level of laxity goes down, you're managing your hypermobility so much better. The exercises I use for joint hypermobility and in general to treat all joint related issues are developmental exercises. These are the same exercises that got you as a newborn baby to become a running toddler. You and I and every walking human being on the planet Earth has gone through those same stages of development without being told what to do. So we're hardwired to do them, and if they've materialized into stability for every walking human being, that is the method to use to stabilize now. In fact, that is what I use in my practice. They're low impact on the joints and they're highly effective. Look around you. And so if you understand and learn what the principles involved are, then you have that knowledge going forward, so you hold the solution to your joint instability, and that is a lot better way to live your life and manage your life than basically being at the mercy of your providers. If you have joint hypermobility, if you have TMJ, if you are tired of your joint instability and you're ready to learn and you need help, contact me using one of the methods of contact in the description box. There is a link where you can connect to my office to set up a time so you and I can talk briefly to see what's going on, and if your situation is something I can help you with. Until next time, take care.